Topics about fracture of the nose. The location of the nose make it susceptible to injury. Nasal fracture is the most common facial fracture and the most common fracture in the body. Fracture of the nose usually result from the direct assault. The nasal fractures may affect the ascending process of the maxilla and the septum. So the broken nose is a break or crack in the bone in your nose. Common cause of the broken nose include the physical fights, sports, fall, and motor or vehicle accidents that result in facial trauma. The next one is the clinical manifestation. So we have 7. The signs and symptoms of the nasal fracture are the pain. So autoimmune disease can cause pain in the nose. So it's a condition in which your immune system mistakenly attacks your body. So ito yung white blood cells natin. Sila yung nagbabantay or pinapatay nila yung mga foreign invaders or microbes such as bacteria, viruses, parasites, and fungi para hindi mag-spread. Then the next one is bleeding from the nose externally and internally into the pharynx. So nosebleeds are common. They may be scary, but they rarely indicate a serious medical problem. So we have two kinds of nosebleeds. We have the anterior nosebleeds. So the anterior nosebleeds occur when the blood vessels in the front of the nose break and bleed. The next one is the posterior. So the posterior nosebleeds occur in the back of the deepest part of the nose. In this case, blood flows down the back of the throat. Posterior nosebleed can be dangerous. The next one is the swelling of the soft tissues. So a contusion or bruise is an injury of the soft tissue often produced by a blunt force such as kick, fall, or blow. The result will be pain and discoloration because of the bleeding into the tissue. So the treatment involves rest, compression, elevation, and anti-inflammatory medicine. So, pwede rin gamitan natin ng ice. Ilagay natin yung ice sa parts kung mayroong injury para ma-reduce yung swelling. Then, next one is adjacent to the nose. Several bones that help form the walls of the nasal cavity have air-containing spaces called the paranasal sinuses, which serve to warm and humidify the incoming air. Periorbital ecchymosis, or the raccoon eye. So, raccoon eye is produced by blood tracking into periorbital tissues, causing blue or purple discoloration of the upper and lower eyelids, which is a frequent symptom after traumatic injuries to the head and neck, include the skull fractures, soft tissues injuries, and convexity fractures and facial fractures. The next one is the nasal obstruction. So, the nasal obstruction is when the nasal passage are blocked or there is difficulty breathing from the nose. So, cause of the nasal obstruction or congestion, we have the chronic sinusitis, allergic rhinitis, environmental irritants such as smoke or dust, sinus infection, cold or flu, certain medications such as high blood pressure medicine. So, next one is the deformity. So, nasal deformities may be caused by a congenital problem and are often present at birth. So, they may include problems caused by a cleft lip or palate, aggravated or perforated septum or a mass on the nose. Additional causes of the nasal deformities may include the nasal trauma, prior nasal surgery, weakening of the nasal structures due to aging. Then the next one is the assessment and diagnostic findings. So we have the nose is examined internally, inspection of the external and internal structures. The injury may be complicated by the fracture of the nasal septum and the subcosal septal hematoma. And the accurate diagnosis can be made only after the swelling subsides. Clear fluid draining from either nostril, such as fracture of the cribriform plate with the leakage of the cerebrospinal fluid. So usually, careful inspection or palpation disclose any deviation of the bone or disruption of the nasal cartilage. So next is the medical management. Bleeding is controlled with the use of packing. Cold compress are used to prevent or reduce edema. Consider the possibility of cervical spine fracture. Ensure the patient the airway and to rule out the cervical spine fracture. So may be treated initially with antibiotics, analgesic agents, and the decostiudant nasal spray to evaluate the need to realign the bones. So next is the nursing management. Immediately after the fracture, the nurse apply ice and encourage the patient to keep the head elevated. Then next is the nurse instruct the patient to apply ice pack to the nose to decrease swelling. The nurse instruct the patient to apply the packing inserted so to stop the bleeding may be uncomfortable and unpleasant. And obstruction of the nasal passage by the packing forces the patient to breathe through the mouth.